Good, thank you very much. Good morning, good afternoon, everyone. That's more like it. Welcome to Hampshire Local Outbreak Engagement Board. Can we start with any apologies for absence, please?
I've not received any, Councillor Manns.
Thank you very much. And declarations of interests. I ask that any member with a disposable pecuniary interest or personal interest in any item on the agenda declare this either now or at the time of the item by first indicating that they wish to speak. Okay, what I'd like to do next is I think Councillor Porter wanted to make a presentation to the committee. Councillor Porter, can I ask you whether this relates to item 9? Because if it doesn't, I will ask you to make your presentation after we've done the minutes and my announcements. We just want to take item 9 first, if that's all right.
That's fine, thank you.
Okay, fine. Well, as you know, the agenda has been adjusted slightly so that we've got the right people around for the actual presentations. Has Jenny turned up yet? Do we know, Simon?
Yes, Jenny's arrived.
Oh, good. Fine. Well, we'll go straight to item 9 if we could. That's NHS Vaccination Programme Overview. This is a verbal report, and I'd like to ask Simon Bryant, the Director of Public Health, to introduce it, please.
Many thanks, Councillor Manns. So this item is around the vaccination programme, the COVID vaccination programme, which is being led by the NHS, and Jenny Irwin is the Senior Responsible Officer for that, and it's great that she's able to present this afternoon. From my perspective, it's a hugely challenging programme, but a really important and absolutely vital part for our protection of the health of the population, which is why Jenny's here today. We work very collaboratively. One of my team works with Jenny very closely on looking at the uptake and all those kind of things, but it is a real logistical challenge. So I'll hand over for Jenny for some of the detail around that. And we can also talk about, and then it's not quite in Jenny's room, but working together on the Frimley and North East Hampshire and Farnham bit, so it's all included this afternoon.
Thank you, Simon. I think everybody can see me okay, yeah? I wanted just to start giving you a kind of a brief shape of the programme. So just essentially the programme is running along the lines of the ICS footprints, but we work very closely with North East Hampshire and Farnham in particular to make sure that we're looking at this from a Hampshire perspective. So everything I'm telling you is absolutely part of the programme in terms of North East Hampshire and Farnham, and I'll make sure that I draw in those components of the programme as we go through. So I'm bringing you a verbal update today simply because the data that's available to us as we started the programme is very much controlled by the centre and kept very much at a national level at the moment. So we're not allowed to share information at a regional or a local level at all at the moment. We're hoping the centre will release the data sets within the next couple of weeks, at which point we'll be able to give people much more information at a very granular level. So we'll be able to see that across districts and boroughs and CCGs and start to look at some of the local delivery spots across the patch. But I'll give you a broad overview of the programme and then leave some space for any questions. So
could I stop you just very briefly, Jenny? I don't know whether you joined the call before we announced that these proceedings are broadcast. So this is a live broadcast, just so that you know.
Of course, yeah, I'm aware. Thank you. So I think I just wanted to start with the aim of the programme, really, which is very much around saving as many lives as possible, as quickly as possible, and also reducing hospitalisations and pressure on the NHS. So the COVID vaccination really is targeted at this moment in time to the top 4 groups from the JCVI cohorts. That's the Joint Committee for Vaccinations and Immunisations. So nationally, clinically, they've decided who goes first. That's very much about who's most at risk. So the phase 1 of our programme is about saving lives and preventing hospital admission. And therefore, the people that we're targeting first for vaccination are people living in care homes and the people that look after those individuals in care homes, and people who are over the age of 80, and now moving down a bit further into people over the age of 75 and people over the age of 70 in distinct groups, and also those who are extremely clinically vulnerable. So those groups are the ones we're targeting first, and our aim is to reach all of those groups for a first dose vaccination offer by the 14th February. We are well on track in Hampshire and the Isle of Wight, including North East Hants Farnham, to achieve that aim. We have got through to 84% of our care homes across the patch, and we've got through 70% of our people over the age of 80, and that's across the whole of Hampshire and Isle of Wight together. So we're going great guns, and most of that delivery is by our primary care network. So that's absolutely in local places for populations through their GP practice networks. The model of delivery comes in three modes essentially. So we're running community vaccination services, which are led by our GP practices. That will include outreach to nursing and care home locations, as I've said, but that also includes reaching to housebound patients as well. So our GPs will be leading on all of that work. And then in order to support them, we have hospital hubs as well. And our hospital hubs have been set up within our main acute hospitals across Hampshire and the Isle of Wight. And they are there really at the moment to vaccinate staff. And that is all health and social care staff who are in frontline roles, who have immediate contact with people who are in the at-risk groups that we talked about. So very much your frontline health and social care workforce. So we've been working together with our county and local and city councils to make sure we really understand who all of those people are in terms of workforce, and that we get them through into that hospital hub capacity as soon as possible. In addition to the hospital hub model, we're also going to have vaccination centres across Hampshire and the Isle of Wight. When we commenced the programme, we did some work to model where we thought those large vaccination centres needed to be. And I think our initial and immediate thinking was that having one large mass vaccination centre for Hampshire and the Isle of Wight was not the right thing to do, because we recognise that Hampshire and the Isle of Wight are quite diverse communities, and actually having one thing was immediately not going to be right for most of the people that lived in that place. So what we have looked at is having smaller but more disparate services so that more people can access them local to where they live. So by the beginning of February, not quite live just yet, but by the beginning of February, we will have 4 vaccination centres across Hampshire and the Isle of Wight. One will be up in Basingstoke in the fire station. The second will be at Oakley Road down in Southampton. Now the Oakley Road Centre is currently open and operating as a hospital hub, but from early next week it will become a vaccination centre. And then we will have one over in St James's in Portsmouth and another one over on the Isle of Wight. We are also working closely with our networks of local pharmacies as well, and so NHS England have centrally commissioned a number of local pharmacies who will also come online, and they again will be able to vaccinate people from local pharmacy premises. There are sort of 2 ways of getting to their capacity. So if the general practice service calls people up, they will do that in the normal way that they would. So when they do flu immunisations or call any patient for something they'd expect, they use their normal GP practice systems, and they'll contact their patients that are well known to them, either by letter or by telephone, and pull them into booked appointments. In addition to that, the larger centres, the vaccination centres and the pharmacies will be using the National Booking Service, and the National Booking Service will write to people centrally, so it will draw down all of the people that are in those groups and write to them and offer them an appointment at one of the vaccination centres. At the moment, the national system is using a radius of 60 miles from that person's address. And so if you get a letter to attend a vaccination centre, you have the option to go anywhere that's open within 60 miles of your address. So that may or may not be in Hampshire, and that's also quite useful if you live up on the border of Hampshire and Isle of Wight, because it means you don't get stuck travelling, into the centre of Hampshire. If you live on the edge, you can go up into the North East Hants Farnham, or even across into Berkshire, or wherever meets your needs and suits you the best. And it allows people much more flexibility with appointments, especially when we get into the wider groups of people where there's many more people in the cohorts. And once we get down into the wider cohorts from 5 through to 9, which is much more the general population and starts to involve lots more people. So we aim to have completed the first dose for everybody by the summer. We haven't got specific deadlines on that as yet, because the capacity that we've got available to us is kind of contracting and flexing as needed across the patch. But we will be able to offer that to everybody in Hampshire and Isle of Wight. And we're beautifully on track to deliver at the moment. As I say, I only have those top level headlines because we don't have access to local data yet. I think if I just pause there, Simon, do you want to come in and add anything around the framework of the programme? Because we've been working quite closely with Simon and colleagues on this one.
No, I think it's just worth emphasising that point, Jenny, that at this point in time, the vaccination programme is to protect life and to ensure the health and social care system can work, and it is working really, really well from that perspective. And I know there's a lot of appetite for people to get vaccinated, and as Jenny said, we're working through those cohorts really strictly according to the Joint Committee of Vaccinations and Immunisations criteria.
Thank you very much, Jenny. Are you open for questions? Fine.
Of course.
Fine. Well, I'd like to ask one to start the ball rolling, or really two wrapped into one. First is the information that that nationally is being used to invite people to go to the large vaccination centres. Is that provided? Where does that come from? In other words, is it the same information as the GP practices have, or what?
Exactly, yes. So they would do it in the same way that they would send a member of the public a letter about an immunisation they should have. They would draw that from GP clinical records, the same way that you would have a call-up letter for a flu vaccination, for example. So
that's done nationally, and then how is that coordinated with any letters that go out from GP surgeries? So
there is a challenge at the moment that the national system isn't quite talking to the GP system as we would like. So there are some patients who have been called essentially by their GP practice, but then also received a letter from the National Booking Service. But when you book with the National Booking Service, the letter does say that you can talk to your local services if you prefer. I think within a couple of weeks, when all of our sites and services and teams are up and running, when somebody gets an offer letter, that it will be very clear exactly in the letter what they can access and where they can access it locally. But I think for now, people who are called in the next couple of weeks will have a letter which shows them they can either go to a vaccination centre that's live at the moment, which wouldn't necessarily be in Hampshire. They'll have several options, or they can go to their local GP practice. What we are asking is that people don't contact their local GP practice just because of the sheer volume of contacts they've had. The GP practices will contact people when they're ready, but they will know if they've already been vaccinated through the national booking process. So they'll be able to see and know that that person's already been vaccinated. So you wouldn't get called by your practice if you'd already been to a vaccination centre. They will talk to each other and know that.
Well, that's the next question. So basically, if you have a vaccination in one centre or in the GP or wherever, the other part of the system knows that that has happened.
Absolutely, yeah.
So right. How is that done? Is that just done automatically online or what?
Yes, through the systems that would normally talk to each other, through the network of immunisation systems that we've already got. I have to confess, I'm not a technical person, so my knowledge about how the IT infrastructure speaks to itself is not strong, but it absolutely does.
Because that information obviously would have to be keyed in at the different locations for it to be accurate. And linked to that, more about a quick question about the supply of the vaccines. Presumably that is allocated centrally, so it's going to come from different manufacturers and probably different sites for the different manufacturers. Does it come into a central site anywhere, or is it sent directly from the manufacturer to, if you like, where the end user is going to get the injection? And if it's allocated, how does the allocation process link up to the process to know when people have been vaccinated? if you see my point. If you've allocated a certain number of that amount of vaccine to either a national centre or a GP practice, clearly that's going to change if some of those people at that practice or in that 60-mile area have already been vaccinated after the original decision as to how much to send has been made. Am I making any sense?
Of course you are, absolutely, yes. And what I would say is that the system that's collating all of this information is one and the same. So all of the deliveries come down in what we call at the moment a push model. So the national centre knows, for example, you know, how many people over the age of 80 there are left in this primary care network that have not yet been vaccinated, and the allocation of vaccine is aligned to what we know that demand and that need looks like. So it will come down to the primary care network on the assumption that that's how much they need in order to get through what they've said they can do in a week, aligned with that population. So the idea is that we make sure that at a national level we go, as Simon said, we focus on protecting lives and saving people from going into hospital, and that focus is so the vaccine is spread across the country in that way, and everybody is getting the same access to vaccine in the right way. So absolutely, yes, those two things are intrinsically linked in terms of supply and demand and delivery.
That's very, very useful to know. The final point, it really relates to how the vaccines are sent from the manufacturer. Do they directly go to the sites that we've been talking about, or is there a central warehouse, if you like, that they go to first, or is it a mixture of both?
Probably a mixture of both. I couldn't tell you the answer, but certainly it's all nationally controlled by the centre. Whether they're controlling that digitally and virtually and it's coming in and going straight, I couldn't tell you, but certainly there's a very clear logistics and supply route for it as it comes into the country and then is distributed out to all of the locations and sites that we're using.
Jenny, that has been really helpful. I'm sorry to hog it a bit, but I thought it was quite important to understand how the system works. We've got a few other questions. Liz, Councillor Fairhurst.
Thank you, Leader. Jenny, can I just ask you, it's quite apposite having this meeting today, because I got a couple of phone calls this morning from residents who had received letters telling them to report to our local centre to get their vaccinations. But at the same time, they'd read in the newspaper over breakfast that actually some places are being told not to give vaccines and they've to stop because other places are running out. And actually, both of them just asked me, what should they do? Well, my advice to them was to just go anyway. But is there a danger that in Hampshire we will be held back because other places are not keeping up with us?
So I wouldn't want to use the language of being held back, because absolutely it's about everybody achieving the same aim, which again, as we said, it's about protecting lives and making sure that people don't end up in hospital where they're at risk of doing so. So I think as long as everybody gets through, particularly the people who are over the age of 80 and those people who live in care homes and the staff that look after them and the health and social care staff who are out there on the front line looking after all of our patients, that's the core priority. So anybody that's not receiving vaccine as a primary care network will be because they are ahead in terms of they've got through to that population. I think the next step for us as a whole system programme team, and then linking with our regional and national colleagues, is to look at, okay, so phase 1 complete, phase 2, what next? How do we then make sure that, exactly as you say, we haven't got chunks of capacity that we're wasting because we're pausing or waiting or whatever. So it is very difficult to coordinate, but we absolutely have to make sure that the vaccine lands aligned with the people who need to be jabbed in that order through that JCVI cohort. It's very clinically driven to make sure that we do the most to save people's lives. So it's really important whilst we're in phase 1 that that's the order of play.
Thank you, Jenny. Judith Gajewski.
Thank you. Yes, Jenny, it's great that the vaccination programme is being rolled out so quickly, and it would seem quite smoothly at the moment, fingers crossed. But what are you doing to manage people's expectations? Clearly, just because they've had one vaccine or one vaccination does not mean that it's back to whatever they were doing pre-COVID and let's have a I've been vaccinated party and so on. And I suspect this is going to be more of a problem as we move more into the ambulatory and free to move around population. So what are you doing to advise people and manage those expectations?
Thank you. I'm going to bring Simon in at this point, I think, because I think that.
Yeah, by all means, Simon, perhaps you could answer that.
Yeah, absolutely. It's a really key point, because I think we are hearing anecdotally people think, I've had my vaccine, that's it, I'm out having a party. And we spoke in our health protection board just earlier this afternoon how we're going to really make sure we get the comms out, working both with those vaccinating, but also the general comms, because it's really important that people still manage all the good behaviours don't work, but all the kind of habits of hand washing, social distancing. So we need to get that right, and we'll also be working with our vaccination centres to make sure that message is given clearly by the vaccinator. So it's you're right, it's a real challenge. We need to get it right, otherwise we're going to be in another problem.
Thanks, Simon. I obviously appreciate that we're doing all that stuff, but I just wasn't sure if, as this is an NHS-led programme, if they had specific comms that they were giving out.
Absolutely, we do, yes, and we're keeping all those messages absolutely aligned with our local authority and public health colleagues as well. So I think that's really important. But there's a huge comms package that comes out, particularly with primary care, because they're so close to their patients, to make sure that everybody receives that information as they get their vaccine, about not assuming that they're therefore immune the next day, etc., and making sure that people's behaviour doesn't change just because they've been immediately vaccinated, for sure.
Thank you.
I think I've got one more question for you, Jenny, because I know you've got to get away soon. Judith Gillow.
Yes, thank you. Jenny, I ran a patient and public engagement meeting this morning, and I got feedback about the national issue about getting national invites as well as invites from the GPs, and this is causing a lot of confusion. And people were saying they were ringing their GP because they didn't know what to do. Should they go to the GP or should they go to one of the larger hubs? I know it was really helpful. You said it will be sorted out probably in the next 2 weeks, but I just wonder if there's any comms to be done at the moment, because from the areas that were on this group, they were all saying it was causing a lot of confusion and concern.
Yeah, for sure, Judy, we can take that point away. I think you're absolutely right. It's very difficult when something is happening at a national level in comparison, in conjunction with something happening at a local level. But we can make sure that's really clear for people as well. And,
no, thank you, Jenny. Thank you very much.
I have got a couple of other questions. Councillor Ken Rattigan.
Thank you, Keith. Two very quick points. With the 3 modes of delivery plus the pharmacies, have we got any idea what the capacity will be in totality once we get to that? And secondly, maybe one for my Hampshire County colleagues, do we have a number for the police and teachers so as they can be fed into the system as they are likely to be moved up the ladder as government recognise their importance to civil society? 2 questions. Thank you.
Thank you, Ken. Absolutely. I think that for the first point, we do know exactly how much our maximum and minimum capacity is against all of those 3 delivery modes. It's not information that I can share in this moment in time, but I am publishing a vaccinations plan just in the next few days, ideally, but certainly early next week. And what I would do is set out almost that roadmap so people can really see through all those cohorts of people how and when and where we're going to get through all of them in that sort of timely fashion. What I would say about police, teachers and other colleagues is there is a very live debate, of course, about where those individuals fit, and some of that is around business continuity planning, and some of that is around how at risk those individuals are from a physical health point of view. But I think, if my clinical lead was here, he would absolutely go back to age is the most significant risk factor. And so therefore, that is the reason those cohorts come down, particularly in age group, because we know that that's the most at-risk factor. So we are working very closely with our LRF colleagues, and we will absolutely make sure that in the background, they're all planning how to bring those people to the forefront, and they will get their letters and be able to book in through the vaccination centres, which will be spread across Hampshire and Isle of Wight as well. So they will be prioritised, and we'll make sure there's capacity for them for sure.
Through you, Chair, can I ask that we get a sight of that capacity number before anyone else, so as we can review it, and if there are any questions, we can ask those up front rather than let it go out into the public and the public asks a million questions. Thank you.
And I'll work with Jenny. I'll be working with Jenny on that. So we'll give that Health Protection Board oversight, because Jenny's in the same place as we need to have the right capacity.
I think I've now got one final question from Councillor Patricia Stallard, and then we must let Jenny go, because I know she's on a tight schedule.
Thank you very much, Leader, and I apologise for being a few minutes late, but I had to leave another meeting before I was able to join this one. Really, the first comment is just an observation for Jenny and for Simon. Living in a very rural area, my elderly residents, i.e. those aged 80 and over, have been called to communal vaccination centres, and they've had to travel some distance. Now, many of them don't drive cars. Many of them don't have elderly residents or indeed volunteers nowadays to take them. So that has been and continues to be a huge problem for many older people. It's great if you live in the city, but not if you live outside in rural areas, and it's a real problem for them. But the question I'm being repeatedly asked is, I've had a vaccination, I've had this particular vaccine, whatever it might be. When I'm called for the second one, what if I get there and it's not the same as my first one? Can I refuse it? Should I have it? What's the response to those questions?
So there's two things. Then I'll probably bring Simon in on a bit of this as well. But I think firstly, to show, I appreciate, as I said, with the national booking system, it's a little bit lumpy at the moment because some of our vaccination centres that are closer for people are not visible to them when they're receiving those letters. So the distance bit is a bit of an issue. But once all of our vaccination services are live, within a couple of weeks, everybody who lives in Hampshire and the Isle of Wight will be within 10 miles of a place where they can go to be vaccinated. And we're also working really closely through the LRF to make sure that we've got volunteer transport services and all of that capacity available to people. So if people do need support to physically get there, we'll be able to provide that as well without cost, and particularly focusing on places like rural areas where it's more of a challenge.
And that will be well publicised, will it, Jenny?
Absolutely, we'll make sure it is, for sure. Yeah. And to the second point, we are assured by the national team that the booking system is very focused on knowing when the first dose occurred and knowing when the second dose occurred. And one of the reasons that people, broadly speaking, unless there's a really significant clinical reason, need to go back to the location they had their first vaccination is very much to make sure that they get the second dose from the first one that they had. And the systems know which one they had and know which one they're being called back for. And when they receive their first vaccine, they will be immediately booked for the second one. So you will leave your vaccination appointment knowing when your second appointment is, with that date and time in your hand, essentially. So that process is being managed very tightly for exactly that reason, because we don't want people not being clear about where to go or what happens with that stuff.
So they should already have that date and venue.
They should do, yeah.
Okay, thank you.
Jenny, thank you very much. I think that's been incredibly informative and very useful. And I hope you won't mind if we invite you back to one forum or another, just to spread some of that, what I call very useful information, which I'm certain will reassure a lot of people regarding some of the questions that have been posed. So thank you very much. Simon, is there anything you want to add to this particular item before we go back to the original agenda?
No, not at all. If there's any questions that come up in the meeting, I will pick them up outside and link with Jenny. So yeah, please be assured, members, if you've missed the opportunity, I'll connect in and hopefully be able to answer them. OK, Jenny, you are free to go if you wish to do so before anyone thinks of anything else to ask you. OK, right, let's revert back to the original programme. And on that, we've done declarations of interest, we've done item 9. The next item on the programme is minutes. Just to confirm the minutes of the previous meeting on the 15th of December. Are you all happy with those minutes? Are there any points on them that you want clarification on? Okay. Right. Let's move on. I don't have any specific announcements apart from the general observation that we still need to be really careful and abide by all the rules. It looks as if
the rate of increase is at least moderating a bit in terms of infections, but this is no time to reduce our guard. And I think that it also applies to people who have had the vaccination because of the possibility of reinfecting others, even though they've had it. Let me move on now to deputations. Councillor Porter.
Thank you very much, Leader. And it was an extremely useful presentation. In fact, it's taken out 2 of my questions, so you'll be very pleased to hear that. I noticed that the agenda includes the vaccination programme, but not the testing programme or the tracking of the outbreaks. And I presume to some extent that Simon will explain that in his report. But as a local county councillor, I can still see the figures rising and falling from individual areas, but have no insight from these meetings about exactly how the outbreak board is specifically targeting likely causes. And I wondered if we have had a conversation locally about supermarkets, but really we've got very little other information. I'm also conscious the public, and I think this ties up with what Councillor Gracia was talking about just now, conscious that the public doesn't really understand what the vaccination does for them. I've had lots of people say, do I have to change my behaviour when I've been vaccinated? And I think this is a public engagement conversation. That's why I've brought it here. Answers really differ quite wildly. And I just think this is something we need to start addressing in the general population, as well as the people that have been immunised. People will need to know this. So how do we get the message out about what they should do before those second immunisations, and also for the whole population, not just for the individual person? And the next one was a straight question, really. Why was the whole week of vaccinations at Holiday Inn cancelled at the last minute, creating a huge amount of work, quite a lot of travel from people who actually went there, but didn't realise their appointment had been cancelled? And what actions are there to make sure it doesn't happen again? And the last thing is something that's happened this week, which it happened particularly in Bishop's Waltham, but it may have happened anywhere else that we haven't heard from people. Elderly people have been told by relations not to answer withheld phone calls or phone calls they don't recognise because of the scam situation. And as a result, we've had notice that people have not actually picked up the phone call from a withheld phone call that's been made from a doctor's surgery. It's probably done with the best intentions, in the sense that most people are using their home phones or their work phones in order to make calls out to get people to come along, rather than just using the surgery phone. But as a result, the number's not known. So I think it ties up again with what Judith mentioned earlier, but it's also the local calls. They're not recognising the number as a COVID vaccination invitation, so they're not picking up. So when the relations have perhaps called to say, why hasn't my grandmother had a call, they're saying, well, actually they were phoned, but they've not answered it. So I think that's something else. That how do we address this failure to communicate, and how do we get that message out? That's really my main points this week. Thank you.
Thank you very much, Councillor Porter. I'm certain that Simon will cover some of the answers to those particular points when he speaks a little later or very soon. And not only that, but if there are other issues that we can find answers to, certainly we will. But thank you very much. Let's move on to item 6, which is the Outbreak Control Position Report. So I'll hand over to Simon Bryant, the Director of Public Health.
Many thanks, Councillor Manns. I will share my screen if that's okay with colleagues. And as I do that, I will just pick up a couple of points that Councillor Porter made around the vaccination programme, if that's okay. I hope you can see that presentation. Great. So just with, I can answer the specifics which wouldn't be covered by my presentation. So you're absolutely right, Councillor Porter, we need to be really clear what the vaccination does and what it doesn't do. It protects you from severe illness and the consequences of COVID. You may get a mild illness, but it doesn't prevent you spreading it. So we are being really clear about that, as we said, working with Jenny's team to make sure the messages are clear. And we picked that up in our health protection board this morning to make sure those messages are clearly spread throughout our whole population. Let's spread the messages, not the virus. With regard to the Holiday Inn, I did pick this, it is the responsibility of the CCG, so I'm kind of relaying a message. But what happened was at the early part of the vaccination programme, that vaccine stock was sent somewhere else with lower vaccine uptake, and there was an error in the cancellation system, which is run centrally at that point. So there's an organisation, an NHS organisation, I think in the north of England. They have apologised profusely, but they hadn't managed to cancel the appointments they needed to cancel. So there was a kind of mechanical error in that. But yeah, we did look at that. Let me move on to my presentation. This is our weekly data pack. I will canter through fairly fast because you've seen the format, but really happy to take questions on any aspects as always. So the weekly case rate for the week 53 and week 1. Just worth saying, nationally, they've changed the scale. So here you can see that anything in dark red is over 335. Now it's over 1,000. So you can see that actually it's quite difficult to compare the maps. But just to bear in mind, we can see the difference in the areas is probably the easiest thing, with Hampshire being lower than East Sussex, Surrey and Slough and places like that. So in the main, and our cities with the island higher. So we can see that the case rates were highest in our 20 to 59-year-olds, although declining in the majority of age groups. And I think it's really, when we look at that, it's really worth bearing that in mind, in the majority, but not all age groups. So there's some age groups where it's not declining. This map, as my colleague colloquially calls it, the bruise map, you can see it's beginning to be a little bit of a nicer colour across Hampshire, with Winchester district having lower rates than other areas. Bear in mind this is to the 14th of January, but really, you know, we've seen that over in Kent being that darker purple. And also look at our R rate, which is now 1 to 1.2. So still a little bit higher than we wanted, but slowing down, and we're seeing the rates of infection coming down, which is really positive. And then when we look at our ceremonial Hampshire, as it's called in this graph, you can see the cumulative rate across the whole pandemic, with England at the top. And so this is a rate, so they're comparable, and Hampshire now right down the bottom because the Isle of Wight rate has shot up very quickly. So we can see that's you know where we are, and you can see the impact of the pandemic across the whole of the population. And then looking at our daily cases, we've had 48,000 cases in total across the whole of the pandemic in Hampshire, and you can see at the peak we had 1,657 cases in a single day. So you can see we're coming really nicely down from that. And when we look at the rate, we'll see what's happening there. And you can see, although not comparable because of testing, you can see there's 144 cases here, mainly hospitalised. So really important just to bear that in mind. And then when we look at the map, and I realise some of the dates don't tally up, the way the data comes through, when you want to show these things, we have to use the data available, but we can see Rushmore with a rate of 930, and then Havant at 541 at our second highest, and right down to Winchester at 289. So we can see what we're seeing there is a falling in rates in most areas. I think Gosport has now begun to fall, although you just need to kind of bear in mind these figures, some are falling more slowly than others. So we're all coming down, but some are falling more slowly, keeping a close eye on it, and depending on your view, how you kind of want to say that. But I think we want to say the great position is it's coming down. Let's be mindful that it's not coming down as fast as it went up, particularly because of this new strain and the way that the people are living in lockdown may not be quite as strict due to things being open and people having fatigue, meaning that the rates are not likely to fall as fast as they did in the first wave. When we do trends by district, you can see across the piece, they're all kind of coming down. We can see that sharp rise and fall in Rushmore, others a little bit more steady. And the 7-day rates here, you can see that Hampshire has a rate of 453, and that's below South East at 532 and England at 520. So really good news. And you can see that Rushmore had the highest rate, followed by Havant. And as I always talk about, the over 60s rate, really important due to the hospitalisations. And again, we've got it slowing, and we have begun to see that across these districts as well. But it is now beginning to show that downturn across all areas. But we just need to keep a close eye on that in terms of the over 60s. And then this tartan rug of ages, you can see the age groups, and we know that there's still quite a lot of high transmission in this younger age population, and we know nationally that actually it's still not falling in that 20 to 35-year-old age group. So we've got to keep an eye on that for a number of reasons, and we know there's a higher rate in that very old population who are likely to get severely ill. And then this is really encouraging. I think for the first time we've been able to show that week by week we can see that fall, and remember that's a point in time, but you can see some really happy green bars there, whereas previously they've been red. So we can see a decreasing trend across all areas, which is very, very good news. The hospital data from the public side isn't quite as up to date as you may know if you can get local hospital data, but the thing to see is these vast numbers of people in hospital. So Frimley Hospital has 609 people in hospital, Portsmouth 503, and it's going up. We're beginning to see that steady off, so that kind of plateauing in each of our hospitals, which is really great news. Because the infection rates begin to come down, we'll start to see that fall in the next kind of week or so. But mechanical ventilation we're still seeing an increase in people in mechanical ventilation, so the ventilator beds, critical care, which we're all so aware of, is such a key resource that we need. And we've got 52 people in Southampton, 40 in Portsmouth, 39 in Frimley, and 7 in Hampshire Hospital. So we're really concerned about that, which is why we're in this lockdown period, because the NHS was getting overwhelmed. And if you saw the news last night, I think you'll understand the way nurses and doctors are trying to care for people. Just finally, it's really worth looking at death data, because we know people do sadly die of COVID, and we've sadly had over 1,600 people die, and 126 deaths in the latest week, and we begin to see we're slightly higher than the 5-year average now. Again, we've been below that for a little while, but now we're creeping up again. So sadly, we know that following a peak of infections, a few weeks later we see a peak of mortality. This is just a summary of that data, which is on our website. And I guess the key messages are that we need to think about how we're going to further support our populations, and through our comms teams and our delivery teams who are doing an awful lot of that work going forward. Councillor Mann, shall I quickly go on to the next item to take those together?
Yes, if you could, Simon, that'd be fine. Item 7, that'd be great.
So first of all, I might, if I can bring in Laura Taylor, but we do an awful lot of work with our businesses to really support them to manage some of the issues that they're dealing with, supermarkets and smaller businesses and faith settings. And Laura, being our district chief executive lead, has been taking some of that forward. Laura, do you want to give a quick summary of that work?
Thank you, Simon. Thank you, Chairman. So as Simon says, our district and borough councils are working at the front line of that community edge control of infection. And in turn, this, of course, protects our valuable NHS resources. So first of all, members, I would say, of course, that all the requirements from the current round of national restrictions are in place across the county. And throughout the pandemic, districts and boroughs have provided advice to business to help them deliver COVID secure operations. But it is critical now, even just as the tide might be turning and infection rates are just starting to drop, that we ensure that those businesses who see large numbers of people have COVID secure operations in place so that people can shop safe. So therefore, we're going a little bit further, and over the last week and continuing forward, our environmental health teams have been visiting all retail stores from corner shops right through to supermarkets to ensure that COVID secure measures are in place and providing advice when necessary. So that's our work with retail stores, which are open for essential goods only, of course, members. But we also recognise the importance of taxis and private hire vehicles. For some people, they are essential methods of transport to perhaps get that vaccination, to get some shopping, or to provide support for shielding relatives. So we have, as our district licensing teams, provided advice to our main taxi operators, and those teams are available to any driver who wants to understand how to put COVID secure measures in place. We've done that throughout the pandemic, and we continue to do so. And on top of that, of course, our local town centres are supported by council teams and many other partners such as BIDS or the police, in order to ensure people can visit safe when people have to make those essential trips. notwithstanding, of course, that the key message for all of us is to stay home where possible. So thank you, Simon. Hope that's helpful, Chairman.
Yes, thank you very much, Laura. Very helpful.
And then just finally, it's really, I think I would like to just inform the board about community testing. So we've heard a lot about this. This is what you might colloquially call mass testing in the population. This is where we have lateral flows available for people to who are asymptomatic to be able to have a rapid test that enables people to understand if they have the disease or not. It's not as accurate as the PCR test, but it's certainly helpful to prevent the spread of infection. So we're working up a bid. We were allowed to do this following our entry into lockdown. It takes quite a lot of work, but that will roll out across the county, working with our colleagues in the districts and the fire service and others to enable front-facing workers to get a test as they're out and about. And that's really important. As Laura said, we know that people need to go to essential shops, teachers need to go to school, and transport workers need to run our transport. So we're working with our colleagues to make sure that people can get access to these tests and understand if they are positive. If so, they'll then need to isolate and take a PCR test to confirm that, and then contacts need to take that appropriate action. So we are really ramping that up. We are working with the military planners this week to hopefully sign off a bid either end of this week or very early next week to take that forward. And there'll be sites across our across all of our patch. It's worth saying there's lots of noise around this. So whether people can do it at home, or they have to do it in centre, what's it licensed for? At the minute, it's not licensed to be taken at home, although we are seeing different news coming out for different staff members. So we're just working through that, which is why we need a centre. But equally, if you have a centre, you don't want to bring people together because we need people to social distance. So we're working through all those logistics to have what looks like to be an 8-week programme of community testing for our frontline workers to break the legs of the infection. So they'll pick up asymptomatic people for them to then isolate, and we'll support that with track and trace as well. So that's a really exciting development, large piece of work that we are very quickly rolling out and learning from places like Kent and Slough. Councillor Manns, the other key development is the vaccination. We've heard a lot about that, so I won't further say anything about that.
Thank you very much, Simon. Has anyone got any questions for Simon? Okay, if we can move straight on to item 8. Before we do so, are you happy with the recommendations? If you're not happy, put your hand up. If you are happy, you don't need to do anything. Can't see any hands, so those recommendations are approved. Moving on to item 8, communication engagement update. Councillor Judith Grajewski.
Thank you. I'm just finding the right page on my computer. There we are. Yes, thank you. You've got the information summary in the pack, and it's the same format as we're all used to now. This summary covers the period from the 1st of December to the 6th of January, and then I'll bring you right up to today, if you like, in a few minutes toward the end. As you'd expect in the rapidly changing situation during the last few weeks, there's been a lot of comms activity and an awful lot of engagement. Social media posts reached over 1.1 million people. I mean, I'll just say 1.1 million people, it's a huge number. And I think it's evidence that residents are clearly looking to the County Council for reliable information as the situation evolved through the tier changes, Christmas and lockdown. There were 136 social media posts in that time, including video content covering everything from student travel procedures to food vouchers for vulnerable families, the Shop Safe scheme or campaign that's already been mentioned, or Shop Safe, Shop Local, and the national vaccine rollout alongside the continuing advice around testing, the importance of self-isolating, safe socialising for young people, and the weekly COVID-19. Unsurprisingly, the most viewed post was the Tier 4 announcement on the 27th of December. Enquiries in the last 5 weeks, or in the 5 weeks to the 6th of January, led to 150 news items in that time. And the key areas of inquiry included the tier escalations, vaccines and testing, schools and cases in care homes. And I should emphasise, I alluded to this earlier, that the vaccination programme is the responsibility of the NHS. However, we are amplifying their comms as a partner organisation. Moving to the right of what's on the agenda, that page, we ran a powerful Christmas campaign with the strapline "Best Gift for Christmas." For those you love is to follow the rules. And there was some very engaging imagery there. We also had the follow the Yule rules about Christmas bubbles, which was also pushed hard, especially as the rules around bubbles were tightened fairly close to Christmas. And then, of course, there was the stay-at-home advice for New Year. Stakeholder and partner engagement has continued with the districts and parish councils, including downloadable posters within the e-bulletin so that parishes and anybody else can download them and display them wherever they wish. And looking ahead, we'll be addressing vaccine hesitancy, support to self-isolate, support bubbles during lockdown, and linked to that, mental health and well-being, and we'll continue to provide shielding advice. We'll continue promoting the financial support available, including for unpaid carers, access to food vouchers for vulnerable families, and fuel poverty measures. I can update you that last week we did a lot of comms around the new variant and the stay safe message, the hands, face, space, to business operators in collaboration with the Economic Development Department and all of the districts. And we'll be providing updates about testing. Simon's talked about that. We're at an early stage, but we will be providing updates about that in due course, as we have already been receiving inquiries about community testing. School inquiries have gone comparatively quiet, as you might expect, although we are continuing to engage with schools and have continued to proactively communicate with nurseries. Coming right up to date, we're now looking at outdoor media and working with the ETE department to identify suitable sites. So there may be a sign coming close to you soon. 3 final points. We're now promoting the latest iteration of the Every Mind Matters campaign, focusing particularly on young people. We're promoting the extended operating hours of the COVID-19 helpline, and also the Connect for Communities pages on the County Council website, where there's detailed information about food and fuel vouchers, community pantries, and support for families and children, including how to apply for a Connect for Communities grant. And these grants are focused on vulnerable children. And Chairman, can I just finish by thanking our officers in comms for everything they're doing, as they're also trying to keep up with all the other public health messaging that's going on. And I have to say that the standard of the comms being delivered is extremely high, with powerful imagery, strong messaging, and also presentation variety to keep people interested, and it, you know, what they're looking at this week, they don't think they already saw it next week. So it's, you know, getting a good balance there to keep people fully engaged. You know, it is so important that we do this, because we are going to be dealing with this pandemic for some considerable time yet. Thank you.
Thank you very much, Judith, and I add my own thanks to the comms team, because it's been a pretty busy period. Mm-hmm. And I suspect that it's going to get possibly even more busy, as I think a number of questions, and we've heard some today, relating to the vaccinations, when they occur, who gets them, where they take place, and indeed what the effect that has on the lockdown rules that we have. And if you add all that lot together, that's probably quite a lot of very important information to get out to the general public in Hampshire through our communications. Anyway, thank you for that. And can I see if there are any questions for Judith, or any general questions? Ken.
Thank you, Chair. Judith, just to reiterate something that Laura Taylor said, are we going to get out a message on single shoppers? Because families still seem to arrive at supermarkets in tow, 2 or 3, and their children. It is a concern because obviously children under 11 don't have to wear masks, and it is a spreading possibility. I just wonder, are we going to get something out on that?
And they run around as well, don't they, when you're in there, and come quite close. But Simon and I were actually talking about supermarkets earlier in the week, and I think you had a meeting with some supermarket people, Simon. Could you give us a bit of an update on that, please? No,
I haven't actually met with the supermarkets. We've done a really clear letter for the supermarkets, as Laura said, and worked with them. So, Councillor Rashkin, you're right. We have also promoted the kind of, as you stick to the rules. Actually, the rules are you need to shop on your own because it's for essential goods. It's not for an outing, as we're also desperate to have, even if it is to the supermarket. So yeah, I agree with that's really important. I will make sure that that gets reiterated.
It's a good point, Ken. Actually, you're absolutely right about the importance of single shoppers. It's not something that perhaps has had quite the same high profile as distancing or other things like that. Any other questions?
Can I just say, Simon, perhaps we could do something on that and work something up for so people know what to expect when they go to a supermarket. And Laura.
The fruit and veg, yeah.
Good. Laura.
Thank you, Councillor Manns. And just to provide some reassurance, when our EH teams are visiting supermarkets, they have the national checklist. And one of the points on that is for people to shop solo. So we are checking that with each individual store to build on what is often the national publicity of please come on your own. But it certainly requires some confidence for someone who is controlling the entry into the shop to have that conversation several times a day. So yes, some additional comms across the county would be helpful on that, but we are checking that as we visit. Thank you.
Thank you, Laura. Patricia.
Thank you, Leader. Yes, on that particular subject about supermarkets, I'm just wondering, Laura, how far afield that your team were able to reach, because a local large store not too far from me not only allows people to go in 2s and occasionally 3s, but without wearing masks. And I've actually been in there while people have not been wearing masks, and no one's challenged them at all. Now, I find this very worrying. What pressures can we put on, and how can we put those pressures on?
Through you, Chairman. Yes, indeed, Councillor, we're very happy to put that particular retail establishment up the visit list if there's an issue there. Very happy to do that. There are a couple of ways. Certainly our EH teams are authorised to have that conversation if they observe that in store with the manager. If the particular supermarket was part of a national chain, there is a local council somewhere in the nation that is responsible for that chain. They may provide advice to them, at which point we would contact them and go in through that route. It's called the primary authority route. So if there were consistent problems with a store that our EHOs couldn't resolve on the ground, we would take that up to the primary authority. So, but very happy to receive from any member of the public or any councillor if there's a particular store that needs a visit as a priority, and we'll pick that up straight away.
I can email you.
Yes, do let me know, Councillor. Yes.
Judith.
Yes, thank you. Just a little story, but if you bear with me, there is a point to this. I was in the supermarket just over a week ago and they'd run out of something I wanted. And the lady said, oh no, we won't be getting it back in until the day after tomorrow. And I thought, oh, it'll be gone by the time I come. So I said, I won't be in because like most people, I'm probably shopping only, once a week at most. And the response was, and Laura, you'll know where I was, the response from the assistant was, oh, you wouldn't believe it. It's just business as usual. Same people in here day after day after day. So I think perhaps there's some messaging about how frequently shop. I mean, we shop. I mean, we know we don't want people to run out of loo rolls or bread or milk and so on. But planning their shopping. I know it means fewer trips out and it's boring at home, but it's safe at home. So perhaps we should be doing something around that. Thank you.
That's a good idea. Thank you, Judith. Any more questions before we close? Well, thank you all very much. I think what's very clear is it's, as I said earlier, it's a busy period. We've not only got the lockdown itself and all the stats associated with that, but obviously we've also got the testing and of course the vaccinations. And I suspect in the future we'll be talking a lot more about the messaging over the vaccinations, who gets it when, how you get relatively equal treatment, at least across the county, if not across the southeast. So our next formal meeting is on the 16th of February at 10 a.m. I've got written down here. And I think before that we will have some more briefings. And obviously there will be meetings with local authority leaders as well. And we'll probably have, I don't know whether we've got one next week, but we'll certainly have them when we need them. And I suspect they will increasingly be looking at how the vaccination program's going across the county. So thank you all very much. And the meeting's over. And Samira, if you...
Thank you, Keith.